So in the second part, or second PowerPoint, there are a couple different parts. We're going to talk about specifically the sympathetic nervous system and the parasympathetic nervous system. So I'm going to have a little section on sympathetic, little section on parasympathetic. So really we're going to address now specifically the learning objectives, primary functions of sympathetic, primary functions of the parasympathetic, and the effects of those individual ones within various organs and systems of the body. So my favorite chart to study for the exam is on page 182, and it has the effects of the parasympathetic and sympathetic nervous system. I'm sorry, page 181, whether it increases something or decreases something, and we'll talk about those. So the sympathetic efferent neurons, the cell bodies of the sympathetic preganglionic neurons, we have that two-neuron pathway, preganglionic and postganglionic. So the cell bodies of those preganglionic neurons are in the lateral horn of the spinal cord gray matter between T1 and L2, so sort of in the trunk of your body. You can think of it that way. So they call the chain of sympathetic ganglia the sympathetic trunk. You can remember that it's in the trunk of your body because it's the sympathetic trunk. I don't know if that helps at all, but anyway, there you go. The sympathetic efferents, they innervate the adrenal medulla, which produces norepinephrine and epinephrine. They innervate the vasculature, sweat glands, erectors of hair cells, and viscera. So all of those are obviously involved in maintaining circulation and body temperature. Very important for the major effects of the sympathetic nervous system. So there are direct connections from the spinal cord to the adrenal medulla. And so the adrenal medulla can sort of be considered a specialized sympathetic ganglion that secretes epinephrine and norepinephrine directly into the bloodstream. So it has a lot of functions. You can think about the individual sympathetic trunk ganglia that are between T1 and L2, and then the adrenal medulla can on the kidneys can also be considered a specialized sympathetic ganglion. So sympathetic signals to the gastrointestinal tract slow or stop peristalsis. They reduce glandular secretions, and they constrict sphincters in the digestive system. So if you start to think about the sympathetic system, remember it's your fight or flight system. If you have to fight a tiger or run from it, you do not want to be stopping to digest or secrete or do anything having to do with digestion. You need your resources for something else. The primary role of the sympathetic nervous system is to maintain optimal blood supply in the organs. So there is moderate activity of the sympathetic system going on all the time to stimulate the smooth muscle in the walls of blood vessels, maintaining some contraction of the vessel walls. So that's kind of maintaining our blood pressure. Increasing sympathetic activity further constricts the vessels, and decreasing sympathetic activity allows vasodilation. So when you look at your chart on page 181, the effect of the blood vessels of the sympathetic nervous system is to constrict those vessels. And the parasympathetic system is going to do the opposite. It's going to vasodilate. So, like I said earlier, the role of the sympathetic nervous system is often illustrated by describing the physiological responses to fear. It's fight or flight. So when you feel threatened, the sympathetic nervous system prepares for vigorous muscle activity. That's that fight or flight. Either you've got to punch the tiger or you've got to run from it. Vasoconstriction in the skin and gut increase. So we vasoconstrict in the skin and gut, and that increases blood flow to active muscles. Gives us the power to fight or run away from the tiger. It increases blood glucose levels. It dilates bronchi and coronary vessels, so we get more oxygen. And it increases blood pressure and heart rate. Sympathetic firing reduces activity in the digestive system. So think about it. Have you ever had a situation where you're not confronted with a tiger, but maybe you're confronted with stress? I think we've all had this. And think about what the sympathetic nervous system is doing when you're you're having a physiological response to fear or stress. I had a long time ago, I had a manager at work when I worked in IT who he was only there for a couple months, thank goodness. But whenever he called me into his office, I had a sympathetic nervous system response. I was terrified. I had no idea what that guy was going to do. So if all of those things are happening, you can imagine that's going to affect your digestive system and your blood pressure and your heart rate and everything. So the sympathetic nervous system doesn't necessarily involve a tiger or a physical threat. It could be some other kind of threat that your body responds to. So the regulation of body temperature by the sympathetic nervous system is exerted by the effects that the sympathetic nervous system has on the metabolism and the skin. So epinephrine released by the adrenal medulla increases the metabolic rate throughout the body. Sympathetic signals control the diameter of blood vessels, the secretion of sweat glands, and the erection of hairs in the skin. So when I was talking about earlier, your external thermoreceptors, temperature receptors tell you that it's cold, and the sympathetic nervous system puts your hairs up and gives you goosebumps. The sympathetic nervous system also regulates blood flow in skeletal muscle. So if you didn't have the sympathetic nervous system working for you, your blood could pool in your lower limbs and abdomen when you're not active. So the sympathetic nervous system prevents that. If your blood did pool in your lower limbs and abdomen, when you stood up, your blood pressure would drop, and that could cause you to faint or cause syncope because it deprives the brain of an adequate blood supply. So when that happens in a clinical setting, we call it orthostatic hypotension. And orthostatic hypotension is autonomic dysfunction caused by some disease process or some other reason. So lots of different disease processes or injuries could cause orthostatic hypotension. One of them is a spinal cord injury. Orthostatic hypotension is a symptom of potentially of a spinal cord injury. And when you see where the sympathetic nervous system, sympathetic ganglia are in the trunk, that makes sense, right? If you had a spinal cord injury, you could affect that vertical system. The arterial walls and skeletal muscle contain those androgenic receptors. So the action of norepinephrine on those receptors causes vasoconstriction of skeletal muscle arterioles. So your local blood chemistry also affects the diameter of arterioles. So the sympathetic nervous system is working in the background all the time to regulate the blood flow in skeletal muscle and prevent things like orthostatic hypotension and to get you ready to deal with any stresses that come along. So in the head, it's cranial nerve input. The sympathetic affects blood flow, sweating, erection of hair cells in the head. They're identical to what happens in the body. The only difference is that you're getting the information from cranial nerves versus the peripheral nerves in the body. The sympathetic signals also dilate the pupil of the eye and assist in elevating the upper eyelid. Those also controlled by cranial nerves. So the viscera are regulated. There are a lot of androgenic receptors in the viscera, and there are a lot of drugs that are blockers that bind with the receptor but don't activate the receptor. So I think we talked about this in pathophysiology. Like the drug Chantix, it binds to a nicotine receptor, but it doesn't activate it. It's basically a blocker. And then there are beta blockers and alpha blockers that block these androgenic receptors. Agonists are drugs that activate the receptors. So they actually have the effect of the drug. So like opioid pain medications are agonists to the receptors that normally bind to our endogenous opiates. So those are drugs that sort of mimic the receptors. The L-Dopa Sinemet that's used in Parkinson's disease is a dopamine agonist. The difference between receptor subtypes allows the design of drugs to bind with one subtype of receptor but not the other. So if you want to have a certain effect, you can design a drug that binds with one, and whether you're going to have it be a blocker or an agonist, that's what a lot of the pharmacology goes into, figuring out what effects the drugs are going to have. So when the adrenal medulla releases epinephrine, the most significant effect is stimulation of the metabolism in cells throughout the body. And the release usually coincides with a generalized release of norepinephrine from sympathetic postganglionic neurons, because the sympathetic system is often activated as a whole. You get that fight or flight, it's really fast, the whole system gets activated, your system's flooded with norepinephrine, and you can react to what's going on. The epinephrine reinforces the effects of norepinephrine on most of the target organs, in addition to the effects on metabolism. The sympathetic nervous system optimizes blood flow to the organs, regulates body temperature and metabolic rate, and regulates the activity of the viscera. That is the main thing I want you to know for that learning objective. Optimizes blood flow in the organs, regulates body temperature and metabolic rate, and regulates the activity of the viscera.